Diverticulosis is a very common digestive disorder. In westernized countries, more than half of the population over age 60 is affected by this disorder. And 20% of those afflicted develop complications. What is diverticulosis? And how can you prevent it? Be sure to subscribe to our channel for more videos on healthy nutrition and lifestyle. Digestive disorder. What is diverticulosis? Our colon can be described as a muscular tube. We can neither perceive nor control its muscle contractions. The colon can easily push along large and soft stool, but small and firm stool requires more pressure. If this pressure is too large, abnormal pouches can form, similar to a squeezed balloon popping out between your fingers. Diverticulosis describes the condition of having these abnormal pouches, also called diverticula, in your colon. Diverticulosis is less common at age 40, with only 10% being afflicted. But starting from age 40, more and more people develop diverticulosis. At age 60, it affects more than half in westernized countries. Sadly, in recent years, diverticulosis seems to become more prevalent in younger people as well. Complications. Possible complications include rectal bleeding and inflammation of the diverticula, called diverticulitis. Diverticulitis can be extremely painful. Typical symptoms are sudden lower abdominal pain or pain drawn out over several days. Nausea, diarrhea or constipation are also common symptoms. Once the disease progresses, the inflammation can cause fever and bloody stool. In the worst case, the inflamed pouches can burst, which is a serious medical emergency which can be deadly. Diverticulosis is one of the leading reasons for hospitalization. About 20% of those afflicted by diverticulosis develop complications. And sadly, 90% of those dying from diverticulitis didn't even know they had it. To avoid these complications, it's more important than ever to prevent diverticulosis, the formation of the pouches in the first place. Prevention. Looking for clues. Diverticulosis is relatively new. It was practically unknown 100 years ago. In 1907, only 25 cases of diverticulosis were reported in the medical literature. 25 cases total. It is estimated that diverticulosis rates were as low as 2 to 10%. Nowadays, these rates go up to 65% and millions are affected by this disorder. But not everywhere. Rural populations in Africa and Asia are found to have rates as low as 0.5%. But these rates are on the rise, as their diets are getting westernized. What is the key difference between traditional and Western dietary patterns that lead to such a contrast in disease rates? Fiber deficiency. It's fiber. The Western dietary pattern is deficient in fiber. In the US, as little as 3% of the population eats the recommended amount of fiber on a daily basis. Why is fiber important? Because it affects stool size, stool consistency, and passing time. Remember, large and soft stool passes easily. Small, firm stool does not. Fiber feeds our gut bacteria, and on high fiber diets, more than half of our stool is made up of bacteria. Here are some numbers to compare high fiber and fiber deficient diets. Rural Ugandans on a high fiber diet had a passing time of 34 hours and a mean stool size of 450 grams per day. Subjects from the United Kingdom on a low fiber diet had a passing time of 80 hours and a mean stool size of 110 grams a day. If you want to help your colon and prevent diverticulosis, eat more fiber, at least 30 grams a day. The more you eat, the better. Disease risk and dietary patterns. Fiber is only found in plant foods. The less processed, the better. There is no fiber in animal products. It's no wonder that the intake of animal products is correlated with an increased risk for diverticulosis. According to the EPIC Oxford study, compared to those eating more than 100 grams of meat a day, diverticulosis risk dropped by about 16% for those eating less than 50 grams of meat a day. For pescatarians, the risk dropped about 23%, and for vegetarians 35%. But no one could beat the plant-munching vegan whose risk dropped by 78%. Of course, you can be fiber deficient on a vegan diet as well. So regardless of meat intake, don't forget to eat enough unprocessed whole plant foods, like vegetables, fruits, whole grains and legumes. Treatment. Diet recommendations for people with diverticulosis. Once you have diverticulosis, there are a few things you need to know. There is no cure for diverticulosis. The outpouchings of your colon will not heal. The best course of action is to prevent new diverticula from forming and to prevent bleeding and inflammation of existing diverticula as far as possible. A whole food plant-based diet helps to prevent the formation of new diverticula because of its high fiber content. And the anti-inflammatory compounds found in whole plant foods decrease the risk of complications such as bleeding or diverticulitis. Inflammatory foods such as junk food, refined grains, plant oils, meat and dairy should be avoided. Be careful with whole nuts and seeds. If you have experienced pain after eating whole nuts and seeds, please grind them or use nut and seed butters instead. You should not avoid nuts and seeds in general. Corn and popcorn are other candidates to reach your colon undigested. Thanks for watching our video on diverticulosis. If you have any questions about what to eat or not to eat to prevent or treat diverticulosis, let us know in the comments below or write us an email. See you next week.